Welcome back to the deep dive where we take deep dives into really fascinating subjects. Today we're diving into a topic that I think is on a lot of people's minds these days, and that is how artificial intelligence or AI might reshape the healthcare workforce. I think a lot of us have heard the robots are taking over narrative. But today we're examining a 2024 OECD report, and it's called Artificial Intelligence and the Health Workforce. And its findings are surprisingly optimistic, particularly from the doctors themselves. So let's buckle up and explore how AI could impact everything from doctor shortages and burnout to patient care and diagnoses. What are the biggest challenges? And how can we make sure that AI is used responsibly in such a sensitive field like healthcare?
This OECD report provides a unique global perspective because it's actually based on a survey of medical associations all over the world. It's not just a few voices, it's a chorus of perspectives on AI and healthcare.
That's a really good point. It's one thing to hear about AI from, tech companies, but it's another thing entirely to get the perspective of those who would actually be using it on the front lines of healthcare. So let's start with the challenges. The challenges that are facing the healthcare workforce today. I'm sure a lot of our listeners can relate to the frustration of long wait times and the difficulty of just finding a doctor.
Yeah, absolutely. The report brings those frustrations to life with some hard data. It projects a global shortage of 10 million healthcare workers by 2030. And that's on top of the existing burnout. The burnout that we're seeing among doctors and nurses today. These are real people. They're struggling to provide care under immense pressure.
So how does AI offer a potential solution here? I mean, I'm kind of imagining robots, assisting in surgery or something like that.
Well, it's not quite like the movies just yet.
Mm.
But AI's potential really does go beyond the operating room. The report suggests that AI could actually alleviate some of this pressure by taking on some of these tasks. Tasks like, data entry, scheduling,
Yeah.
and even preliminary diagnoses.
So it's more about freeing up human healthcare providers to focus on the complex tasks that really do require that human touch.
Exactly. Think about it. If AI could handle those routine tasks, those time-consuming tasks, it would allow doctors and nurses to spend more time with patients, really listening to their concerns and providing that personalized care that's so essential.
Yeah, that makes a lot of sense. It's about using technology to enhance human capabilities, not replace them. But I'm sure there are concerns. I know I would be a little apprehensive about having my healthcare decisions made by an algorithm.
Oh, you're right. And the report acknowledges that there are very valid concerns. However,
Ah,
one of the most striking findings in the report was that a significant majority, 72% of the survey medical associations, believe that AI's benefits outweigh its risks.
72%. That's a pretty strong vote of confidence from the doctors themselves. What specific benefits are they most excited about?
Well, aside from, reducing burnout and improving efficiency, the report really highlights AI's potential to improve the quality of care and even enhance patient experiences. They cite some really cool examples, like using AI to analyze medical images. So we're talking about things like X-rays and CT scans for more accurate diagnoses, developing personalized treatment plans based on a patient's genetic profile, and even using AI-powered chatbots to answer patient questions and provide 247 support.
Those are some compelling examples. It sounds like AI could revolutionize the way healthcare is delivered. Now, the report includes a specific case study, something about AI being used in pathology.
Yes, it highlighted how a healthcare service in Israel, Maccabi Healthcare Services, is using AI to improve the accuracy and efficiency of cancer diagnoses. They're using AI in conjunction with pathologists, not replacing them. It's an example of how AI can be a really powerful tool to augment human expertise, not eliminate the need for it altogether.
Yeah, that's a crucial distinction. So, to address the elephant in the room, the big question that I think everyone's asking is, will AI replace doctors?
The report's answer to that question is a resounding no. None of the medical associations that were surveyed believe that AI will replace the majority of physicians. Instead, they see AI fundamentally changing the nature of the profession, with doctors acting more as advisors, or assistants equipped with powerful AI tools.
So, it's not about robots taking over, it's about doctors evolving to work in partnership with AI. Okay, I'm starting to understand why there's so much optimism around this, but like with any new technology, there must be challenges to overcome. What did the report identify as the biggest barriers to AI adoption in healthcare?
The report highlights two major barriers. The first is data accessibility. You see, AI needs vast amounts of high-quality data to learn and to improve, but accessing that data, accessing it in a way that protects patient privacy
Mm.
and ensures security, well, that's a significant challenge. And second, The report highlights the need for effective management of AI applications within our current healthcare systems. So making sure that these AI applications are integrated seamlessly into existing workflows and that our healthcare providers are adequately trained to use them effectively.
Those are definitely significant challenges. I can imagine that issues like data privacy and security are particularly concerning for patients. It makes me think about my own medical records, how fragmented they can be. Even just getting them from different doctors, it can be a hassle.
You've hit upon a key point. For AI to really transform healthcare, we need to solve the problem of data fragmentation. The report calls for greater data standardization and interoperability. And essentially that means making sure that healthcare data is collected and stored in a consistent way so that it can be easily shared and analyzed by AI systems.
Now that we have a better understanding of some of the challenges, let's explore what this future could actually look like for patients. What are some of the ways that AI could potentially improve our healthcare experiences?
Well, imagine a future where you walk into a doctor's office and instead of filling out a mountain of paperwork, you just confirm your basic information. And the AI system pulls up your entire medical history from a secure, centralized database.
That would certainly save a lot of time and hassle. I know I've had to repeat my medical history countless times to different doctors.
And it's not just about convenience. Having all of that data in one place could actually lead to better care.
Yeah.
AI could analyze your medical history, your genetics, your lifestyle factors, even the latest medical research to provide your doctor with a really comprehensive view of your health.
So AI could help doctors identify potential risks and personalize treatment plans more effectively.
Exactly. It could also help doctors stay up to date on the latest medical advancements. Medical knowledge is constantly evolving. New research is published every day. It's impossible for any human to keep up with it all. But AI could track those changes, filter out the noise, and deliver the most relevant information to doctors right when they need it.
That's a game changer. Instead of relying on what they learned in medical school, which might be outdated, doctors could have access to the most cutting-edge information at their fingertips. It's like having a super-powered medical librarian by their side.
Precisely. It's all about empowering doctors with the information they need to make the best possible decisions for their patients. But the report is also careful to emphasize that human oversight remains crucial.
That's reassuring. It's important to remember that AI is a tool, not a replacement for human judgment and compassion.
Absolutely. The report stresses that AI should be seen as a tool to enhance human decision-making, not replace it altogether. Doctors will still need to be trained to critically evaluate AI's recommendations, understand its limitations, and always put the patient's best interests first.
So it's not about turning doctors into robots. It's about giving them the tools to be even better humans, more informed, more efficient, and ultimately more compassionate caregivers.
Well said. But of course, this transformation won't happen overnight. Like we discussed earlier, there are barriers to overcome, like data accessibility and the need for widespread digital literacy training, not just for healthcare providers, but for patients as well.
Right. We can't just assume that everyone will be comfortable with AI playing a role in their healthcare.
Exactly. Patients need to understand how AI is being used, what the potential benefits and risks are, and how to advocate for their own needs and preferences in this new landscape.
So it's a two-way street. It's not just about doctors learning to use AI. It's also about patients becoming more informed and empowered to navigate this AI-powered future.
Precisely. And that brings us to another important point. The report highlights the need for clear communication and collaboration between healthcare providers and patients.
So instead of seeing AI as this mysterious black box making decisions behind the scenes, patients should feel comfortable asking their doctors questions about how AI is being used in their care.
Absolutely. The report emphasizes the importance of transparency and open dialogue. Patients should feel empowered to ask questions like, is AI being used to analyze my test results? Or, what are the potential benefits and risks of using AI in this situation?
That makes a lot of sense. It's about building trust and ensuring that patients feel like active participants in their own healthcare decisions, even as AI plays a larger role.
Exactly. And that level of trust and understanding will be crucial as we move towards a future where AI is more deeply integrated into healthcare.
It seems like the success of AI in healthcare hinges on getting this right. It's not just about the technology itself, but also about how it's implemented, how it's explained to patients, and how it's used to enhance, not replace the human element of care.
You've hit the nail on the head. This OECD report really goes beyond the technical aspects of AI and delves into the human side of the equation.
Speaking of the human side, I'm curious to hear more about the report's recommendations for navigating the potential challenges of AI in healthcare.
One of the key recommendations is for policymakers to establish clear guidelines and regulations surrounding the use of AI in healthcare. This includes addressing issues like data privacy and security, algorithmic transparency, and liability in cases where AI-assisted decisions result in negative outcomes.
That sounds essential. We need to make sure that there are safeguards in place to protect both patients and providers as AI becomes more prevalent in healthcare.
Absolutely. And the report also emphasizes the importance of ongoing monitoring and evaluation of AI systems to ensure that they are performing as intended, and that any unintended consequences are identified and addressed quickly.
So it's not a set it and forget it situation. It's about constant vigilance and a willingness to adapt as the technology evolves.
Exactly. And it's going to require collaboration and communication between a wide range of stakeholders, doctors, patients, AI developers, policymakers, and ethicists. This is a complex issue that demands a multifaceted approach.
This is mind-blowing stuff. You know, we're talking about reshaping the entire healthcare landscape, not just tweaking a few things here and there. It's exciting, it's daunting, and it's definitely something we need to be talking about.
I agree, and that's why I'm so glad we're having this conversation today. It's about raising awareness, sparking curiosity, and encouraging everyone to think critically about the role of AI in healthcare.
Well said. And speaking of sparking curiosity, let's shift gears and explore some real-world examples of how AI is already being used in healthcare today. We've talked a lot about the potential of AI in healthcare, but I want to hear about some real-world examples. You know, what are some ways that AI is being used right now to improve patient care?
Well, AI is already making a difference in a variety of areas. One example is in radiology, where AI algorithms are being used to analyze medical images, like X-rays and CT scans, helping radiologists detect and diagnose conditions more accurately and efficiently.
So it's like having a second set of eyes, but with the ability to process vast amounts of data and spot these subtle patterns that a human radiologist might miss.
Exactly. And it's not just about speed and accuracy. AI is also being used to personalize treatment plans. For example, in oncology, AI can analyze a patient's genetic information and medical history to help doctors determine the most effective chemotherapy regimen.
That's incredible. It sounds like AI could really help to take the guesswork out of treatment decisions and tailor those therapies to each individual's unique needs.
That's the goal. And it's not just limited to specialized fields like radiology and oncology. AI is also being used in primary care to help doctors manage chronic conditions, like diabetes and heart disease. AI-powered apps can monitor patients' vital signs, remind them to take their medications, and even provide personalized coaching on lifestyle changes.
It sounds like AI could be a really valuable tool for empowering patients, empowering them to take a more proactive role in managing their own health.
Absolutely. And it can also help to bridge the gap in access to care, in areas where there are shortages of healthcare professionals. AI-powered telehealth platforms can provide remote consultations, diagnosis, and even treatment recommendations.
That's really promising. It sounds like AI has the potential to address some of the most pressing challenges facing healthcare systems today. But with all this talk about AI, it's easy to get caught up in the technology itself. What should patients keep in mind as AI becomes more integrated into their healthcare experiences?
I think it's crucial for patients to remember that AI is a tool, not a replacement for human judgment and empathy. While AI can provide valuable insights and recommendations, the ultimate decision-making power should remain with the patient and their healthcare provider.
So it's about using AI to enhance the doctor-patient relationship, not to replace it.
Precisely. Patients should feel comfortable asking their doctors about how AI is being used in their care. You know what data is being collected, how are the algorithms being trained, what are the potential benefits and limitations of using AI in this particular situation.
Those are all great questions to ask. It's about being an informed and engaged patient, even as the technology evolves.
Exactly. And remember, you always have the right to refuse AI-assisted care if you're not comfortable with it. The ultimate decision about your healthcare should always be yours.
That's an important reminder. It's easy to feel overwhelmed by all this talk about AI, but ultimately it's about using this technology responsibly to improve patient care and create a healthcare system that is more efficient, more effective, and more patient-centered.
I couldn't agree more. The future of healthcare is bright, and AI has the potential to play a transformative role. But it's up to all of us patients, providers, and policymakers to ensure that it's used in a way that benefits everyone.
Well, thank you for joining us on this deep dive into the world of AI and healthcare. We hope you found it informative and thought-provoking. And remember, the future of healthcare is not predetermined. It's something we're all actively shaping. With our choices, our actions, and our voices, be sure to subscribe to the deep dive for more fascinating explorations into the world of, well, everything.